Cell Target Diagnostics aims at bringing STD testing at home. STDs are on the rise. 130 million people in the world live with chlamydia. This accounts for 40% of all STDs. The main problem is the antibiotic resistance and increasing number of reports reporting that both gonorrhea and chlamydia are becoming resistant. This makes it one of the most serious public health concerns today. The prevalence of chlamydia is 1 in 30 people, but the real problem is that 60% of those who have it don't actually show any symptoms at all, meaning the disease keeps on spreading silently, which is really the problem of chlamydia. In terms of the prognosis, if you're a woman, you have 1 in 4 chances of developing pelvic inflammatory disease leading to infertility, and for men, you have 1 in 6 chances of developing reactive arthritis, which causes basically atrocious testicular pain. The solution is very simple, and it can be cured with a single dose of antibiotics. However, the friction points at the moment for the consumer is that they have to go to a sexual health clinic and wait for hours and get the results at best the next day or the same evening. Sometimes it takes even a few days. Or you can have a test at home, which you have to order the test. It's quite expensive. It is completely private, but you have to send the sample to a lab, and it takes 5 or 7 days to have the results back. What we are doing is tackling both speed and cost by having this microchip, which can detect chlamydia and report it. The cost of the chip like this is under £1 today in a lab made in batches of 6 to 12. So of course, if you were to do it at an industrial scale, it would cost absolutely pennies. The time is about 9 to 20 minutes. Which is, of course, a dramatic change from current solutions. And it works in the same way a pregnancy test does. You just have to use a urine sample and let the chip do its work. Market size, it's considerably big for chlamydia. We have 16 million tests every year performed in the US and 2 million in the UK. But at the moment, although we are only tackling chlamydia, the technology is applicable for all bacterial cells. So we can also extend this with a bit of research to gonorrhea and syphilis, as well as potentially UTIs. So the market will be absolutely huge. The impact it has in developing countries is 2-tier. The first is that you don't need to have a doctor to take samples and give you the test, and secondly, you don't need to have a lab to analyze the results. This is very important for developing nations because they don't have access to both labs and doctors as easily as they do in the West. Our route to market is to go through partnership and license the technology. We want to find a suitable partner or several partners for different regions that would both manufacture and sell the tests. We would then have a second income stream, which would be to look at the aggregated data that we collect, so not individual patients' data for privacy, but the actual understanding how the disease spreads and the prevalence of it. We can sell this data back to insurance companies as well as to CDCs and public health authorities. The partner at the moment that we are looking at is BGI. BGI sequenced the coronavirus in China and distributed, I think, 100 or 200,000 tests for free to the Chinese government. They are a public company in Shenzhen looking at DNA sequencing, and they showed extreme interest in our product if the technology can be licensed and gets patented. At the moment, we are currently waiting on a patent. We have applied for a patent 4 months ago, and the journey started in 2015 when we won the London Techstar Challenge, and it took us 4 years to develop the prototype. And now we have on board an advisor, which is Professor Flasia, who helped us and was very important in developing the contacts with BGI. We need more money now to apply for the CE marking and to keep on developing the design of the product, which is what we are doing at the moment. And of course, applying for international patent applications in 18 months from now. In the team, we have myself, a third-year PhD student in biomedical engineering here at Imperial, and my friend Ricardo, who launched an online pharmacy called Mani in the UK. They have raised 1.4 million pounds in funding in 2019, and he's now looking at a second venture. We also have Dr. Yu Song from BGI Genomics. He's the one that signed the letter of intent for us and is interested in following up the development of the technology, as well as Professor Flesia, who is the professor in photonics in Rome, who introduced us to BGI. Thank you.